There are changes in the body as people age, which affects how drugs are metabolized in the body or how the body handles these medications. As part of your HIV care, your team and your GP will be doing regular blood tests to make sure that the medications that you're on are still appropriate. If necessary, we've got a number of different medications that have got excellent safety profiles that we can use as you get a little bit older. And this is something that's important to chat with your healthcare provider about to make sure you're on the best treatment for you. HIV can cause inflammation, and this can have effects on the immune system, and it's one of the things that we think contributes to the risk of developing age-related conditions like cardiovascular disease, bone disease, sometimes cognitive impairment. And we know that in general, being on effective medications with an undetectable viral load will reduce this inflammation and will reduce the risk of these conditions. There probably is some ongoing inflammation even despite being undetectable on your treatment. HIV and the medications that you take for HIV are only some of the factors that are involved in the risk of these conditions. Things like lifestyle, smoking, substance use, other conditions like diabetes, all of these things will also have an additive effect on the risk of these conditions. We do monitor these conditions regularly when you're having your care provided, and we can make changes to your treatment on the basis of that. It's important not to get too weighed down or concerned about these things because they're all manageable and they're only small parts of the whole picture of what contributes to these conditions. What's really important is that your healthcare provider has got an accurate list of the medications you're taking. There can be interactions between the medications that you take for your HIV and the medications that you take for other conditions. What they can do is safely check whether there's any interactions with the medications. Whilst we recognise that people living with HIV may experience some of these age-related conditions, it's important to remember that support is available to help deal with that complexity. So don't be afraid to ask for help because it's there.